Hey guys, today we're going to talk about APRV. APRV stands for Airway Pressure Release Ventilation. APRV is a pressure-controlled mode of ventilation that utilizes a inverse ratio ventilation strategy. APRV is a copyrighted trademark term, so you may hear terms such as bi-level ventilation or inverse ratio ventilation. They all mean the exact same thing. With APRV, a continuous pressure is applied to the lungs for an extended period of time and then released for short periods of time. So think of it as a inverse ratio on your IDE. So if I've got continuous PIP applied for 4, 6, up to 8 seconds, and then I release it for less than 1 second, it is exactly the opposite of what you would expect to see on a normal ventilator. These are extremely sick patients that are on APRV, usually your acute lung injuries, your ARDS patients that require a special mode of ventilation. We are seeing this a lot during this COVID-19 epidemic. Unfortunately, most transport ventilators do not have this mode built into them. There's only a fraction of the transport ventilators out there that are able to actually perform a correct APRV. However, there is a workaround for transport ventilators that do not have APRV settings. We can sort of mimic the APRV settings that the hospital has. So hopefully we'll be able to transport that patient successfully on a transport ventilator that does not have APRV settings. I do want to caution anyone attempting this strategy that you're going to want to spend extra time at bedside with the patient on the transport ventilator to ensure that the patient tolerates the makeshift APRV settings. Also, a true APRV allows for spontaneous respirations. However, it's my recommendation that the first thing you're going to want to do for this patient is to adequately sedate them and paralyze them for transport purposes. You're going to want to start the ventilator as you normally would. It'll be an adult patient that is intubated, and then go ahead and start the ventilator. You'll notice that when the ventilator starts up, it automatically starts in a volume assist control mode. The first thing we're going to want to change is to change that to a pressure control. So it'll also be assist control. So pressure assist control mode. We can leave the respiration rate set at 12. We'll move over to inspiratory pressure. Inspiratory pressure, we're going to move to 20. PEEP, we're going to change to 10. Now here's the odd setting here. Even though we're in a pressure control mode and the volume control setting is grayed out, you still have to set this as high as it'll go to above 1500. And that has to deal with the computer in the ventilator. When we go to change the I time, the computer looks at the tidal volume that is set to determine what the maximum I time is. So in order for us to get an I time of 4.0, which is what we're shooting for here, we have to increase that tidal volume. The last thing we have to do is go back and select inspiratory pressure one more time. And you'll look down at the bottom where it says inspiratory rise. This reflects how quickly the ventilator gives that breath. And we want to set it to the lowest number possible, which is 1. The lower the number, the quicker the breath is delivered. So to review the settings one more time, it is a rate of 12, inspiratory pressure of 20, PEEP of 10, rise time of 1, and an inspiratory time of 4.0. Those are the changes that we're going to make. Remember, in order to get that inspiratory time of 4.0, you have to change the tidal volume to above 1500. With the settings that we've just put in, these are your basic initial APRV settings. They can be manipulated to mimic the APRV settings at the hospital. Remember that in order to get a higher inspiratory time, even though we're in pressure control, you still have to change the tidal volume in order to enable the computer to change the inspiratory time. With those initial settings, this is what the test lung looks like. You'll notice that the test lung and the initial porcine lungs are very similar, with a 4-second inspiratory time and CPAP hold, followed by a very short expiratory time with PEEP. I do want to caution you, you should also enable the control lock after you've completed the settings and before placing this on the patient. The last thing we want to do is to accidentally select a volume control mode and cause significant barotrauma to the patient.